Just recently, a paper was published in The Lancet that claimed to be the definitive study on the benefits and dangers of drinking. The news was apparently not good for those who enjoy alcoholic beverages. It was covered in the news media with headlines like, "There's no safe amount of alcohol." The truth is much less newsy and much more measured. This is Healthcare Triage News. Let's go straight to the research. Let's talk about the limitations of the study design. It's important to note that this study, like most major studies of alcohol, was not a new trial. It was a meta-analysis or a merging of data from many observational studies. It's probably the largest meta-analysis ever done to estimate the risks from drinking for 23 different alcohol-related health problems. The researchers also combined almost 700 sources to estimate the most accurate levels of alcohol consumption worldwide, even trying to find drinking that might otherwise be missed, like from tourism. They then combined all this data into mathematical models to predict the harm from alcohol worldwide. They found that, overall, harms increased with each additional drink per day, and that the overall harms were lowest at 0. And that's how you get those scary headlines. But, and this is a big but, there are limitations here that warrant consideration. Observational data can be very confounded, meaning that unmeasured factors might be the actual cause of the harm. Perhaps people who drink smoke tobacco. Perhaps people who drink are also poor. Perhaps there are genetic differences, health differences, or other factors like BMI that might be the real cause. There are techniques to analyze observational data in a more causal fashion, but none of them could be used here because this analysis aggregated past studies and those studies didn't use them. We don't know if confounders are coming into play because this meta-analysis could only really control overall for age, sex, and location. And that's not the researchers' fault. That's probably all they could do with the data they had, and they could still model population-level effects without them, and that's what they wanted. But when we compile observational study on top of observational study, we become more likely to achieve statistical significance without necessarily improving clinical significance. In other words, very small differences are real, but that doesn't mean those differences are critical. Let's talk about interpreting the results. The news warns that even 1 drink per day carries a risk. But how great is that risk? For each set of 100,000 people who have 1 drink a day per year, 918 can expect to experience one of the 23 alcohol-related problems in any year. Of those who drink nothing, 914 of those people can expect to experience a problem. That means that out of the 100,000 people, 99,082 are unaffected, and 914 will have an issue no matter what. Only 4 in 100,000 people who consume a drink a day may have a problem caused by the drinking, according to this study. At 2 drinks per day, the number experiencing a problem increases to 977. Even at 5 drinks per day, which let's all agree is too much, the vast majority of people are unaffected. I'm not advocating that people should ignore these risks. They're real, but they're much smaller than many other risks in our lives, and much less than the headlines would have you believe, especially at the levels that most agree are permissible. Your risk could be different. This is a population-level study, arguably a worldwide study, but the results are being interpreted at an individual level. They're merging, for instance, the 23 related alcohol issues together, but not everyone experiences those at the same rate. For diabetes and heart disease, for instance, the risks actually decrease with light or moderate drinking. The authors argue that this result is overrun by risks for things like cancer and tuberculosis, which go up. But for many individuals, the risks for diabetes and heart disease are much higher than those for cancer and tuberculosis. Motor vehicle accidents caused by drinking are clearly worse in some places than others, but the study only had data for the United States and extrapolated that worldwide. And it's not clear that everyone is at the same risk in reality. Let's talk about the dangers of too much drinking. This message should not get lost in any argument. There is no debate, and this study confirms once again that heavy drinking is really bad for you. The population level average of daily drinks is 1.9 for women and 3.2 for men, according to this study. That is above US government health recommendations, but it is probably skewed by those who drink heavily, a relatively small percentage of all people who drink. Of course, some drink too much without knowing it. For this study, a drink was defined as 10 grams of pure alcohol, as much as you might get from 1 ounce of spirits, a small shot glass. That's 40% alcohol. 3.4 ounces of wine, that's 13% alcohol, or 12 ounces of beer, that's 3.5% alcohol. Many people consume more than that and still consider it a drink. We need to reframe this debate beyond alcohol. Moderate alcohol consumption is associated with certain improved risk factors for health, which this study confirms, but this is not the same as recommending that people drink. I don't recommend people drink, and I don't know of any health-related professional organizations that do. But just because something is unhealthy in large amounts doesn't mean that we must completely abstain. A chart in the study showed risks rising from alcohol from 0 to 15 drinks per day. Consider that 15 desserts a day would be bad for you. I'm sure I could create a chart showing increasing risk for many diseases from 0 to 15 desserts a day. This could lead to assertions that there's no safe amount of dessert, but it doesn't mean you should never ever eat dessert. Food is not medicine. Neither is alcohol. Alcoholism is terrible, but there's a balance, and we could spend lifetimes arguing over where the line is for many people. The truth is we just don't know. If these studies are intended to drive population-level policy, we should use them as such, to argue that we might want to push people to be wary of overconsumption. Too many people interpret them individually, though, with panic-inducing results. We need better studies. We may have wrung about as much good as we can out of these observational studies. Another meta-analysis is unlikely to tell us anything new. If we want fresh knowledge, a big randomized controlled trial of light to moderate drinking may be needed. One was in the works recently, but it was shut down after the New York Times reported on ethical concerns about the way it was being pitched to and funded by industry. That doesn't mean that a different trial wouldn't be of public interest and worth public funding. If we want to get better answers to the harms and benefits of light to moderate drinking, that may be our only course. Do you like the show? Always helps if you like or subscribe right down there. And another good way for you to support the show is a subscription service called patreon.com, where you, the viewer, can directly support on anything you like $1 a month, more if you like, but if you don't want to, totally fine as well. Go to patreon.com/healthcaretrash to see how you can help. We'd especially like to thank our research associates, Joe Sevitz, Crafty Geek, and Jonathan Dunn, and of course, our Surgeon Admiral Sam. As always, go to hctmerch.com to pick up good healthcare triage merch, and my book, The Bad Food Bible, still on sale in stores.